7 human medications that are safe and effective for dogs. Number 1 for car sickness, vomiting, nausea, gravel. I had many clients use this in practice. It's really quite safe, so generally no real side effects. The standard dog dose is 12.5 milligrams per 10 pounds of body weight, 2 to 3 times a day. These are 50 milligram tablets. Little Tula, you'd be getting a half a tablet twice a day. But you want to be giving it before your dog is going to be nauseous. So if you're going to be going for a car ride, it's a much better idea to give it to your dog 15 to 30 minutes before you get into the car. So Little Tula, I'd just be popping in half of one of these tablets. And the actual name of the drug, Gravel, is dimenhydrinate. Number 2, this is a newer generation antihistamine. It's Cetirizine. This brand is Reactin. Your dog is itching, he's got allergies, maybe he has hives from, say, something like a bee sting. This is a really good option. The standard dog dose is 1 mg per kilo given once a day. So for a 10-pound dog, that would equate to 5 milligrams. These are 10 milligram tablets. Little Tula is just over 20 pounds. Her dose would be 20 milligrams. So Tula should be getting 1 10 milligram tablet. Should be getting that once a day. Number 3, the topical eye medication for people that have red eyes, Clear Eyes. The active ingredient is called naphtazolone, and that's safe for our dogs. Your dog has red inflamed eyes, i.e. allergic conjunctivitis, maybe it's allergy season. You can be putting 1 drop into each affected eye. You can do that 4 times a day for 5 to 7 days. Number 4, this is a human medication, works really well for constipation. It's an osmotic laxative. This is Restoralax. It's also sold under the brand name Miralax. The name of the drug is actually PG 3350. It's very safe, very effective. It works by drawing fluid into the colon, so it's a stool softener. And the really nice thing about it is it comes as a powder form. It has no odor, it has no taste. So it's really easy to dose our dogs. Typical dog doses: 1/8 of a teaspoon once or twice a day for a small dog, 1/4 of a teaspoon once to twice a day for a medium-sized dog. That's what I'll be giving Tula. And then 1/2 a teaspoon once to twice a day for a larger dog. Here you can see it here. Here's the little white powder, right? There's no odor, there's no smell. I don't really want to taste it. So you can just sprinkle this Miralax into their food. It's an easy way to get them to eat it. And then for many dogs, you can see a result within 12 hours. Number 5, your dog's consumed something poisonous. You need to get them to vomit. You need to have 3% hydrogen peroxide. So your dog has just consumed a huge amount of dark chocolate, or you've just seen him lick up a whole bunch of antifreeze. You need to get your dog to vomit as soon as possible. I encourage you to first call your emergency veterinarian. But if you're a ways from the clinic, you need to get your dog to vomit ASAP. You need to have 3% hydrogen peroxide. A typical dog dose is 5 mils or 1 teaspoon per 10 pounds of body weight. Little Tula weighs 20 pounds. Her dose would be 2 of the teaspoons. I encourage you to have a syringe on hand. It's a lot easier to then dose your dog. So imagine we've got 2 syringes full. You're then going to lift up your dog's mouth, open his mouth, squirt it into the back of his throat, hold his muzzle shut so he swallows it. He should vomit within 10 minutes. If he doesn't vomit, it can be repeated 1 more time. Some emergency veterinarians are now suggesting double that dose. So we're looking at 2 teaspoons per 10 pounds of body weight. But they're also saying a maximum of 3 tablespoons, regardless of the size of your dog. Number 6, this is the anti-diarrhea drug sold under the brand name Imodium. This is the generic version. This is Loperamide. Loperamide is a local acting narcotic, and it works by stopping smooth muscle contraction. In other words, you've got the intestines, colon, they stop moving, diarrhea resolved. A few words of caution: there are a few specific breeds, the Collies, the Australian Shepherds. They have a gene mutation called the MDR1 gene mutation. They can't properly metabolize this drug, and they can have serious side effects. The breeds with the MDR1 gene mutation include Collies, include the Australian Shepherds, and a long-haired Whippet. For those breeds in particular, I avoid giving Loperamide. But in general, most dogs can take this drug fine, and if you just give 1 to 2 doses, you're seldom going to see side effects. I would suggest dosing your dog at 1 milligram per 20 pounds of body weight. These are 2 milligram capsules. They're a little 20-pound Tula. She'll be getting half a capsule. If she had diarrhea, I'd be inclined to just give her the 1 dose. Number 7, this is petroleum jelly or Vaseline. I've had dogs that have consumed things, i.e. a chunk of bone, their owner's not been able to bring their dog in. Orally, you can dose your dog at about 1/2 a teaspoon per 10 pounds of body weight. Tula's 20 pounds, about a teaspoon. I would be giving her that twice a day. I expect whatever is in there to move through in 2 to 3 days. So one that's working great is just a natural lubricant. Get whatever's in there to move out. Secondly, it's also good for topical wounds. Your dog has some type of an abrasion. You want to put something on to cover and protect that wound. Vaseline is a good option. It's going to completely cover the skin. gonna form a protective layer and actually speed up wound healing. I happened to cut the tip of my fingernail off a few days ago. Couldn't quite see the pepper, ended up cutting my finger. Feels better with a bit of Vaseline. Thanks so much for watching this edition of Veterinary Secrets of 7 over-the-counter human medications that are safe and effective for our dogs. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.